afternoon. What's you today? How are you?
I'm good. How are you?
I'm great. My name is Krista. Nice meeting you.
Nice meeting you.
All right. Let me just have a seat. So, thank you for coming here. I just would like to introduce myself to you and give you a brief description of our services and also a little bit about myself. So, I am a second-year student at Toronto University Worldwide, and I'm here because I'm working on my practicum as a trainee for my program in marriage and family, for my master's program in marriage and family therapy. And since I am a trainee, I am being supervised for my practicum. So our sessions will be monitored by my supervisor, who is a licensed marriage and family therapist. And let me just discuss more about my scope of practice. So my scope of practice, I mostly will be working with children, teenagers, young adults like yourself. Which, how old are you?
21.
21. Perfect. Such as yourself, and along with adults. I'll be mostly working with a mixture of individual couples and families as well. And also, I am able to do assessments while like during our sessions or even outside of the sessions, which it will allow me to make a little bit of a conceptualization and about like your mental health, and once we assess more about your mental health and your needs and the clinical concerns, we can start off with a treatment plan on how it's best for you to treat your mental, to improve your mental health and treat. Okay. Sounds good.
Sounds good.
Oh, perfect. And will be trained in CBT, which is cognitive behavioral therapy, dialectical behavior therapy, ACT, which is acceptance cognitive therapy, and mindfulness-based cognitive therapy. So in this therapy, I'll be talking more about the risk and benefits of our services. So there will be times that we will talk about some sensitive topics in your life or how you're feeling right now. It can get very serious. It can get very negative, such as you could be angry. You could cry during the session. Feel guilty. Feel frustrated about something that's been going on in your life, which right now which is understandable. There'll be times that you probably get triggered by something painful in your memories, or even share some vulnerable information that may be something that you feel very uncomfortable talking about, which of course is not something that I will force in, which we will get to the benefits, which the benefits of therapy is that I'm a good advocate in self-improvement. You know, I would like my clients to improve their lives and themselves to be their better selves, rather than be their worst selves. Such as improve your confidence, setting healthy goals, setting healthy boundaries, and developing coping skills, healthy coping skills that can help you in case if you're going through something triggering in your life, and you can remember that of things that I'll help you guide with in the future, and along with you accepting yourself as a human being, which we all make mistakes. And in my form of therapy, I like collaboration, meaning me and you work as a team to help you improve yourself, and also like develop all the strategies and coping skills that you will need once you start finding independence. Okay. So our sessions run like the most 50 minutes. That's the most we can do in our practice here. So there'll be times that we will talk about the fees. So this is based off the session. The fees will cost about $30 per session. You can do there are options for you. You can pay through your health insurance, and and for our practice, we accept most health insurance here in New York. And if you have any more questions about our billing process and involving like overcharging, you could talk to our receptionist about this. She's very skilled with billing and other things, and along with like expiration, or if you need to renew a health insurance or you have to change your health insurance, we will also need you to let us know beforehand. Okay.
Okay.
So let's talk about confidentiality. So everything here that we discuss here in our sessions remains here, stays confidential. Anything that you bring here will not be exposed outside of therapy. However, there will be a time if I need to breach confidentiality, such as if you open to me that you are willing to harm yourself, then I will have to bring this up to a third party, and then we will discuss more about doing an assessment plan to protect you. And another thing is also, if you openly discuss about harming another person, we will have to let the third party know beforehand, and including the person who you have brought up in session, who you're willing to hurt. And with that, I will have to get law enforcement to be involved. And another thing is, I am a mandated reporter here in New York, which means that if you open up to me about anything involving child abuse, dependent abuse, such as abuse against a disabled person or abuse against the elderly, I will have to contact OCFS or any similar agency that reports abuse, and with that law enforcement will have to be involved. Okay, so the next thing is your right as a client here in therapy. So you have full autonomy, meaning you're able to terminate our services at any time if you feel uncomfortable. And another thing is, you also have the right to have, if for example, if you're a dependent person, we will need to have informed consent from the other person who if you're a dependent and the other person is your parent, your caregiver or guardian, we will have to get their informed consent to allow us to continue with the services. Understandable. And so the last thing we will talk about is cancellations. So I would like for you to inform me an hour or at least 30 minutes beforehand if you're either going to be late for our sessions or you have to cancel our sessions. If it could be an emergency or it could be somewhere else, like for example, if you can't make it in person to our office, then we can reschedule for another day. However, if you don't show up in our session, at scheduled session, you will have to charge for late fees, and which will probably.
That's never gonna happen.
How come?
Because I already need this.
Yes.
I already need this session.
I really like how motivated you are and how you are willing to continue on with the sessions.
Thank you.
You're welcome. So, like I said before, it will be charged for late fees if you were to come very late, for example 30 minutes late into our session, or if you're a no-show. Okay, so that will be it. Do you have any questions for me?
No, I don't have any questions. It's good.
Okay, it's good. I'm very happy to meet you, Jeanette, and I can't wait to work with you. Nice to meet you.